हमने। ग्राम सभा को सशक्त कर आसमां छूना सिखाया है हमने। महिलाओं के स्वाभिमान को नई पहचान दी है हमने। 20 सालों में देश के हर गांव के कोने कोने तक पहुंच बनाई है हमने। सरकार की कई लाभकारी योजनाओं से जीवन में नई रोशनी भरी है हमने। ई पंचायत के माध्यम से पारदर्शिता और जवाबदेही सुनिश्चित की है हमने। आओ ग्राम सभा में अपनी भागीदारी को सुनिश्चित करें और पंचायती राज संस्थाओं को जवाबदेह और मजबूत बनाएं। 24 अप्रैल राष्ट्रीय पंचायती राज दिवस के उपलक्ष्य में केंद्रीय पंचायती राज मंत्रालय द्वारा जनहित में जारी।
Are men from Mars?
And women from Venus?
Who is the better half?
Who takes the decisions?
Who is responsible?
Who is demanding?
Who is submissive?
Who is independent?
Can men and women ever find common ground? To find out, watch Gender Discourse every Thursday 4 p.m. only on Lok Sabha Television.
नीचे
काकी, घर में शौचालय कहाँ है? बहू को
घर में कहाँ, खुले में ही जाना पड़ेगा।
फिर तो तुम घूंघट भी खोल ही दो। एक तरफ तो आपको बहू का घूंघट भी सरकाना गवारा नहीं और दूसरी तरफ उसे खुले में।
इस तरह तो हमने कभी सोचा ही नहीं था।
तो अब सोचो, घर में शौचालय बनवाओ और इस्तेमाल करो।
शुरू करें निर्मल भारत।
जहाँ सोच वहाँ शौचालय।
Hello and a very warm welcome to this edition of Public Forum. I'm Shalini Verma. More than 1 million babies die on the first day of their life globally, making the first 24 hours the most dangerous day for babies in nearly every country, rich and poor alike. This is one of the major findings of Save the Children and NGO's 14th Annual State of World's Mothers Report. The report says that India alone accounts for 29% of the world's newborn deaths, which is far ahead even of Nigeria, Pakistan and China. Despite having numerous schemes on paper to address the issue of maternal care and child mortality, we have failed ourselves. In this edition of Public Forum, we discuss the critical issue of newborn deaths. Right, and joining me in the program is a very esteemed panel of guests. We are joined by Mr. Baijayant Panda, Member of Parliament from Biju Janata Dal Party from Orissa. We are joined by Ms. Neeja Chaudhary, who is a journalist, has been writing and has been working a lot on this particular issue, especially the issue of malnutrition among children. Dr. Srinath Reddy, President of Public Health Foundation of India, and Mr. Thomas Chandy, the CEO of Save the Children Foundation. Well, let's now start the discussion with you, Mr. Thomas Chandy, since I quoted a few figures from the report that came out last week. It certainly cannot get worse than this, but it says a lot about the policies that we've had and of course the implementation and the results, which certainly don't throw a very exciting picture. But what are the reasons that your report identifies behind this dismal picture?
Well, this number is a very shocking statistic and a shameful number for any country to have. The largest number of children dying on the first day is in India, which is about 300,000 children. The reasons are plenty, and the important thing is to focus on where the issues are. I mean, we know that where the issues are. It will be among the most burdened districts in India, so we need to focus on that. The government attention has to reach. We also know that issue of inequity is a huge problem, despite the fact that India has grown in the last couple of decades, had huge economic growth, but at the same time the inequity has also grown wider. So while millions of people would have come out of poverty, but those who remain poor have remained extremely poor, and access for them to primary health care and stuff like that has been very, very difficult. So that is another issue. So there is an issue of focus, there is an issue of huge poverty, inequity. All these things play a role when we look at this huge and difficult number that we are faced with.
Okay, Dr. Reddy, India accounts for the largest number of deaths of infants, primarily because the access to healthcare facilities at the primary level is also very low. Would you agree with this, and why do you think we have this kind of a situation?
The causes for the very high infant mortality, which is mostly pegged because of the deaths in the first month of life, neonatal mortality,
Yes.
are arising because of causes within the health system, failures, and causes outside the health system. Some of the causes outside the health system have been mentioned by Mr. Chandy, of the glaring inequities, poverty, undernutrition. All of these contribute. Of course, undernutrition is something that carries on from a girl child onwards into motherhood and also into the baby. But even things like infrastructure, like road transport, for transporting sick mothers and pregnant mothers and sick children to the hospital, all of these matter. So the whole social determinant complex must also be looked at from the point of view of contributory causes. But within the health system, the neglect of primary health care, despite the good intention that we have had since independence of providing good rural primary health care, has led to inadequate care right at the point of antenatal care to the point of delivery and the postnatal care. And one of the glaring examples is the low health workforce, low in numbers and poor in training. While the National Rural Health Mission has tried to address some of these and has achieved some success in this, we are still woefully short of the required number of nurses, auxiliary nurse midwives, trained community health workers, and even where they are present, their training has been inadequate and they have not been supported with adequate infrastructure. So even if a pregnant mother does overcome all the difficulties and reaches a primary health center, she is not assured of safe delivery in the hands of a skilled birth attendant. And that's one of the major problems we must overcome. So we need a thrust for improving our primary health care by strengthening multiple levels and components of the health system. At the same time, we must also address the social determinants.
Okay, let's talk about the social determinants here, and at the same time, ma'am, address the issues which the report also clearly states, Mr. Chandy. Cultural practices, early marriages and childbearing, low birth weight, stunting, there are different factors that have been blamed for this. But ma'am, what would you like to say about these factors, the prevalence of diseases like anemia among young women? They are not even aware about it, and a practice which we have not been able to contain, that is early marriage. That's something which really is probably the start of this problem. What would you like to say about that?
This report has come like a wake-up call. I mean, the number is so stunning when you look at it. 3 lakh babies dying in India on the first day. I mean, it's mind-boggling. We've been working on the issue of malnutrition, where you try and reverse the trend in the first 1,000 days. 1,000 days will follow. This is the first day we are talking about, where a child who should have the right to life and a dignified life, productive life, will not have it. I mean, what could be a bigger human rights issue in the world today or in India today? But somewhere, I don't know why this happens, but they're voiceless, they're lobbyless, their children and women get short shrift of everything. But coming to your question on anemia, I once asked one of the experts who work in this area of public health and particularly focused on nutrition, why is it that our figures are worse than sub-Saharan Africa? And his answer was that it is because of underweight babies. We have them more, and underweight babies get born to underweight mothers. And underweight mothers, why? You have early marriage, you have early pregnancies. In pregnancy, the woman will not be looked after. She will get the bacha kucha khana. It's the way the woman is viewed in the family. Then you come on to the institutional delivery. Of course, the whole issue of access to information, education. The whole thing is inextricably tied to the status of women in our society. And I say that this issue of the first day deaths or of malnutrition, affects just around half the children under 5 in India, is the biggest gender issue today, which has to be addressed not just by health practitioners, it has to be addressed by women activists, it really has to be addressed on an emergency footing.
But then there are different figures between countries and within countries. Well, it's about India. We have different figures coming from different states. Some states have not been really performing very well. And the 3 major states which the report also points towards are Madhya Pradesh, then you have Uttar Pradesh and Orissa. What would you like to say about that, Mr. Panda, since we know that there had been a lot of work that has been undertaken by the state governments, the respective state governments?
First of all, I'd like to say that there are a group of MPs, including myself, who have been working with UNICEF and other stakeholders in trying to create a non-partisan base inside Parliament who would work on this issue without politicizing it. But since you mentioned Odisha, I must also point out that Odisha has traditionally been extremely poor, but in recent years it has seen quite dramatic improvement. But even despite that improvement, we still have these concerns of first day deaths. There are 3 or 4 things I'd like to say about it. These are shocking numbers, of course. But what is much more shocking is that even the children that survive, you have a lot more deaths within the first 6 months and the first year. The need is to concentrate on the first 1,000 days, as Nirja was pointing out. But even those who survive that, they start out life with a huge disadvantage. Because of that undernutrition, malnutrition, they start from the womb, because the mothers themselves are in such measure undernourished. Underfed. So the children start out with problems of stunting, with problems of lower development, both physically and mentally, and it has lots of challenges throughout the lifespan. So in a country where we are very fond of talking about the demographic dividend, this ought to be really truly shocking, because it's not a demographic dividend that we are expanding every day, but a demographic nightmare unless we can tackle this issue. So the reasons are complex, but since you mentioned that certain states are more affected, it is of course related to poverty. Where you have more poverty, you will almost undoubtedly always find more malnutrition. But sadly, it is not only about poverty, because in the last 20 years we've seen standard of life improving for many sections, including some of the poorest sections of our country. And despite that, you are not seeing a proportionate improvement in malnutrition. Now, this has been commented upon by multilateral agencies that there is something other than just poverty which is also affecting the mix. These are social issues like girls having, something like 80% of teenage girls in India have anemia because of these social practices. Girls are fed last in the home, things like that. And almost half of the women getting married in India are not really women. They are girls. Some of them are just barely 18. So these are all problems that need to be tackled on a war footing. And since I am part of a group which is trying to work on a non-partisan basis, I don't want to politicize the issue. We can always argue that, I have done better, you've done worse, central versus state. All these things I don't want to bring into this. What we need to do is actually work on a war footing. The one thing I would like to say is that it's not that malnutrition is getting worse. It's not. It is actually getting better, but very, very, very slowly. And it's not keeping pace with the growth of the economy, with the improving standards of living in other measures. So what we need to really do is target the worst hits parts of the country. There has been in fact discussion within the Planning Commission, within the central government, in our discussions with leaders of the opposition and government and state and national levels, that we need to target the 200 worst affected districts. because about 8 states or so and about 200 worst affected districts in India contain more of this problem than all of sub-Saharan Africa. But let's not compare ourselves to sub-Saharan Africa. Our neighbors in South Asia, some of them are better off than us.
Yes.
And that is really what we ought to work on. We need to really focus on the 200 worst districts if we are to make a dramatic improvement in the near future.
Okay, we are joined by the Deputy Commissioner with the Deputy Commissioner Child Health from the Ministry of Health and Family Welfare, Mr. P.K. Prabhakar, on phone line with us. Mr. Prabhakar, welcome to the program. I suppose you were listening to the part of the part that we have discussed so far in this program. Mr. Prabhakar, what would you like to say about the points that Mr. Panda just made, that we should focus on the worst affected areas first and probably then we can introduce some changes, and your initial response on the findings of the report released by Save the Children?
Yeah, thank you very much. I have been following this program, and Government of India is aware of the report as well as the facts mentioned therein. Some of the facts are, of course, well known to us. The statistics, of course, the estimates may vary, but we accept the fact that India has highest number because the very fact that we have the highest number of births in every year. We have more than 2.6 crore births, deliveries every year, live births, and our number of newborns who die every year is also high. The rate is high, NMR is quite high, despite it showing a declining trend over the last few years. It is still 31 per 1,000 live births, which is quite high. This translates into a huge number of deaths, especially on the first day, which we about the 2.5 lakh deaths we are estimated, and we are aware of this. And many of the programs that we are taken up in the last few years, especially under the National Rural Health Mission, address this issue head on.
What are the reasons that your ministry has identified, sir, behind these appalling figures?
This figure, actually, one of the reasons is that we have to have safe delivery at birth. This is very important because the newborn death and health is not just depending upon the birth, but also on the health of the mother and how young she is, whether she is having multiple pregnancy, whether she has any complications or difficulty during the pregnancy, what care she has received in the antenatal period, and how much care she has been taken during the pregnancy, any complications that occur in pregnancy. All these factors will definitely have a role in the outcome. And as I said, the outcome depends not only on the mother, but also the health of the mother. If the mother is young, she is adolescent, or she is a late adolescent, she has early marriage, she has too many children, then it is a multiple pregnancy, then naturally there are chances of she having complication and also the baby having problem, baby being premature, baby being low birth. These also increased proportionately or disproportionately, leading to neonatal health problems as well as neonatal mortality.
Okay, Mr. Prabhakar, I would request you to kindly stay online. We'll slip into a very short break, and maybe in the other segments also we'll get back to you on the initiatives that have been taken by the ministry as well as the status of the implementation. We'll take a very short break in Public Forum. Please stay tuned for more.
बहुत अच्छे नंबरों से पास हुआ और मैं भी फर्स्ट आई। इन्हें किसी की नजर न लगे।
नजर कैसे लगेगी? परिवार की खुशहाली का मूल मंत्र परिवार नियोजन जो अपनाया है हमने।
सच में हमने बच्चों के बीच 3 साल का अंतर रखा, जिससे बच्चों को अच्छे स्वास्थ्य के साथ साथ अच्छी परवरिश भी मिले।
इससे तुम्हारी सेहत भी तो अच्छी रही।
सुखी परिवार का सही आधार परिवार नियोजन। अधिक जानकारी के लिए अपने नजदीकी स्वास्थ्य केंद्र से संपर्क करें।
बापू का सपना देखो साकार हुआ,
20 साल का अपना पंचायती राज हुआ।
कुछ सपने थे उन आँखों में, नए रंग उन सपनों में भर दिए हमने। ग्राम सभा को सशक्त कर आसमां छूना सिखाया है हमने। महिलाओं के स्वाभिमान को नई पहचान दी है हमने। 20 सालों में देश के हर गांव के कोने कोने तक पहुंच बनाई है हमने। सरकार की कई लाभकारी योजनाओं से जीवन में नई रोशनी भरी है हमने। ई पंचायत के माध्यम से पारदर्शिता और जवाबदेही सुनिश्चित की है हमने। आओ ग्राम सभा में अपनी भागीदारी को सुनिश्चित करें। और पंचायती राज संस्थाओं को जवाबदेह और मजबूत बनाएं। 24 अप्रैल राष्ट्रीय पंचायती राज दिवस के उपलक्ष्य में केंद्रीय पंचायती राज मंत्रालय द्वारा जनहित में जारी।
500 लोग आ रहे हैं शादी में,
तो हम लोग 700 लोग का खाना बनवाएंगे।
लड़की की कुंडली में दोष दिख रहा है। कैसा दोष पंडित जी? अन्न का दोष।
क्या मतलब?
लड़की की शादी में अन्न की बर्बादी होगी, जिससे अन्न देवता नाराज हो जाएंगे। एक उपाय है, बारातियों के खाने का इंतजाम जरूरत के हिसाब से करें, फिर भी भोजन बच जाए तो गरीबों में बांट दें।
धरती पर उगे अन्न पर सबका अधिकार है,
इसे व्यर्थ न जाने दें।
किसी का अधिकार न छीने।
जागो ग्राहक जागो।
लो आई तारा की मम्मी। सरपंच ने पूछा,
आज खाने में क्या बना? चावल, चना और हरी सब्जी वहाँ है।
सरपंच ने दिया ध्यान, तो बने इतने पौष्टिक पकवान।
हमको कितना अच्छा खाना मिलता है ना।
बच्चों का अधिकार है शिक्षा और पौष्टिक आहार जो दे चुस्ती, खेल कूद और पढ़ाई के लिए। मिलकर करे इनका पढ़ना पक्का।
मिड डे मील योजना का लाभ देश के 11 करोड़ से भी अधिक बच्चे पाते हैं।
बापू का सपना देखो साकार हुआ,
20 साल का अपना पंचायती राज हुआ।
कुछ सपने थे उन आँखों में, नए रंग उन सपनों में भर दिए हमने। ग्राम सभा को सशक्त कर आसमां छूना सिखाया है हमने। महिलाओं के स्वाभिमान को नई पहचान दी है हमने। 20 सालों में देश के हर गांव के कोने कोने तक पहुंच बनाई है हमने। सरकार की कई लाभकारी योजनाओं से जीवन में नई रोशनी भरी है हमने। ई पंचायत के माध्यम से पारदर्शिता और जवाबदेही सुनिश्चित की है हमने। आओ ग्राम सभा में अपनी भागीदारी को सुनिश्चित करें और पंचायती राज संस्थाओं को जवाबदेह और मजबूत बनाएं। 24 अप्रैल राष्ट्रीय पंचायती राज दिवस के उपलक्ष्य में केंद्रीय पंचायती राज मंत्रालय द्वारा जनहित में जारी।
मंजू बिटिया, थक गई होगी, थोड़ा आराम कर ले। 6वां महीना चल रहा है ना।
अरे बाबूजी, आराम करूंगी तो काम कैसे खत्म होगा? तू आराम कर, मैं कर दूंगी।
अरे मैं कर दूंगी।
मैं भी कर दूंगा।
गर्भ के दौरान ध्यान रखें कि गर्भवती माँ दिन में कम से कम 2 घंटे जरूर आराम करे और रात में कम से कम 8 घंटे सोए। साथ ही घर में एक खुशी का माहौल बनाए रखें। और वो 4 बातें याद है ना? 1, गर्भवती को खाना अच्छा। 2, पहला गाढ़ा दूध है सच्चा। 3, 6 महीने सिर्फ स्तनपान। और 4, फिर स्तनपान और पोषण का ध्यान। तो 4 बातों से नाता जोड़ो, कहो कुपोषण भारत छोड़ो।
Welcome back to Public Forum. In Public Forum today we are talking about newborn deaths. Okay, so in recent years, at least in India, we have seen that there had been some achievement in bringing down deaths per 1,000 live births, that is infant mortality, but deaths within 28 days of birth, that is neonatal, and under 5 mortality are the areas where certainly efforts have to be made. In fact, the Minister of Health and Family Welfare also accepted it during one of the meetings in this year. In the beginning of this year. What would you like to say about the figures that were quoted by the official from the ministry, Mr. Chande?
Well, the fact is that India has a large population and 300,000, and there are 26 million children who are born every year. But however, you should look at the proportion, you should look at the denominator. And if you look at countries like sub-Saharan Africa, their burden is about 12 per 1,000. On the first day, 12 children die on the first day, and when you look at India, it is 11. So to say that we are better off than sub-Saharan Africa, I don't think we should really be gloating on something like that, because every child matters, and 11 out of 1,000 is still a huge number.
Huge number.
Yes.
Okay, now let's talk about states like Madhya Pradesh, Uttar Pradesh, and Orissa. Dr. Reddy, I would like to start with you, sir. Since there have been reports and there have been clear statistics that institutional deliveries in these particular states that I mentioned, they have not been, the figure is not very discouraging. We have 63% of institutional deliveries recorded in Madhya Pradesh. In Uttar Pradesh, of course, it's less than 50%. In Odisha, it's near 50% again. Still, maybe it's not just these facilities that are really able to help these states to come over the huge figures which they've really lacked.
Absolutely. The problem here is that if you look at the interstate disparities, a girl baby born in Madhya Pradesh is 6 times more likely to die in the first year of first year of life than a girl baby born in Kerala. Infant mortality rate in Kerala is 12 per 1,000, which is almost as good as Sri Lanka. So if it can be done in one state in India, why can't it be done in other states in India? Partly because of social determinants, long history of social development in India, in Kerala with gender equity and all that, but also because of access to health care and access to good quality health care. It's not just merely setting up of facilities. Having adequately trained staff deployed is very important. Madhya Pradesh is very deficient in doctors and has a health workforce crisis even in terms of nurses, and therefore the ratio of health workforce to 1,000 population is very low. I mean in the sense there's a huge disparity between other states and states like Madhya Pradesh. And unless you have adequately trained nurses, community health workers and doctors available in the facilities that have been set up, you are not going to get the kind of care required. And if you are very short of doctors, then you ought to use non-physician healthcare providers. Abhay Bang, for example, has shown in Gadchiroli, in a very poor area of Maharashtra, that by training community health workers, you can reduce neonatal mortality and infant mortality substantially. Now, those are the kind of innovations that ought to be tried and scaled up. So it is very important for us to provide trained birth attendants right from the village level to the sub-center level to the rest of the primary healthcare system. Unless that is done, we are not going to see much of a change. Plus, of course, if you are going to have anemic adolescents, gender discrimination at birth, early marriage, all of these are going to be also factors that are going to influence, and Madhya Pradesh in some of those social indicators is far behind some of the other states. They have to catch up. So you need action, as has been repeatedly pointed out, both within the health system as well as outside the health system. Let me just make one more point. It is very important in a mission mode to focus on the first 1,000 days of life, but it is incomplete, because if you are going to have an unwanted girl child, an underfed girl child, an anemic adolescent going into an early marriage, living in a rural poverty, then even focusing on the first 1,000 days of life is not going to make difference just by focusing on pregnancy. You need to have action at different levels at every stage of life. But certainly in a mission mode, focus on the first 1,000 days, because what is measured is done, so have some indicators there. But unless there is a total change in the social environment, you are not going to see this improving dramatically.
Okay. Mr. Panda, here especially about Orissa, I learned that the malnutrition rates have really come down, and much of it could be really attributed to the Anganwadi centers and to the self-help groups. Do you think that these are the branches which would have really worked well probably in certain other areas too, where we want to really reach to the far-flung areas where people really are not aware about the facilities provided by the government or about the basic things that they should be careful about?
I think we must understand that there is no magic bullet which one solution fits all requirements. There are many reasons why we have seen some improvement in Odisha. Let us also understand that for many decades, Odisha's economic condition was quite dire. It's only in the last 9 or 10 years that the economic growth rate has been robust. In fact, now it is higher than national average for the last decade. So that is one of the factors, because as the economy grows, there are more jobs available, more people are coming out of poverty. So one angle of malnutrition is getting affected. But we have other angles. 1 out of every 4 ODIs is a tribal, and tribals have traditionally been excluded from society. They haven't had the access to education, the access to health. So this is one of the target areas that we need to focus on. Now, so you have economic growth, but if you look for what are some of the factors that contribute to all this. Now, you could be very simplistic and you could say that all the districts that don't have railways have higher poverty and higher malnutrition, and that's actually true. But Railways is just one factor because it impacts the economy, it impacts your ability to go to another place for a job. But it's nothing quite as simplistic as that. You have a host of issues. Now, yes, we have seen some improvement in Odisha. Anganwadis have in fact contributed, and yes, the self-help group movement has been a quite dramatic success over the last 10 years, not just about malnutrition. It has been giving women the ability to stand up for themselves, look after their own families, and be financially independent. And one of the byproducts of that has been an improvement of malnutrition, because many of the school midday meal programs or Anganwadi cooking programs are managed by local women self-help groups whose own children are in those institutions. So yes, that has had an impact. Now, we were talking about institutional births, so I want to make this comment. Just last year, the Mamata scheme in Odisha, where 5,000 rupees is paid to every pregnant woman to go to an institution and have a delivery, has seen a dramatic rise in institutional births. So I'm expecting that the results of this, in terms of more children surviving the first day, more children surviving the first 6 months, we are going to see in the coming 2 or 3 years. There are a couple of other things also. You know, subsidized rice has been available as a social security program in Odisha for 5 years. So you're beginning to see drops in starvation-related malnutrition and deaths. But it all comes down also to societal values. Because irrespective of poverty or people who are moving out of poverty, we are losing sight of certain traditional practices which is causing malnutrition and deaths. One of the things that this advertising campaign that is being conducted today by celebrities such as Amir Khan is that every child when born within the first hour must be breastfed, because there are certain immunity that is built up by breastfeeding within the first hour, and also for the first 6 months the child must be only breastfed, no other external feeding. Now these are practices we have forgotten. So this is nothing that poverty can, overcoming poverty will automatically solve this. We have to get the message out that some of these traditional practices are lifesavers and that we need to retain them.
Okay, on that.
Just on Orissa, I'd like to add something else. Remember also, Orissa is also a very highly malaria endemic state, particularly in the tribal population. That also has an increased level of sickle cell anemia, because wherever malaria is widely prevalent, you have much more sickle cell anemia. And repeated attacks of malaria in childhood also will give rise to undernutrition. So you have to improve the health system overall to tackle some of these problems.
I just want to intervene for just half a minute. Today, when we are discussing some bad news, we must also recognize that there is some good news sometimes. Just today I have read that rotavirus has been developed in India, which is going to cost only about 100 rupees or so per vaccine, which used to cost 20 times of that if you had to import it. This is desperately needed, because one of the problems that we face due to malnutrition is due to hygienic conditions. You have dysentery and diarrhea, and a lot of children actually die from that. Rotavirus has been there's been a financial hurdle to making it universal. I'm hoping that in the near future that won't be such a burden anymore. It could lead to dramatic improvements in malnutrition.
Okay, on that note, we'll take a very short break in Public Forum. Please stay tuned for more.
क्या चल एक और आ गया।
इधर आ, क्या किया बाहर?
जी वो उपभोक्ता अदालत के आदेश को नहीं माना था जी।
क्या? हमने सब कुछ किया, लेकिन अदालत के आदेश को अनदेखा कभी नहीं किया।
गलती हो गई जी।
गलती हो गई तो सजा भुगतो।
उपभोक्ता अदालत के आदेश की अवहेलना न करें, वरना 3 वर्ष तक की सजा या 10,000 रुपए तक का जुर्माना, ये दोनों हो सकते हैं।
जागो ग्राहक जागो।
बापू का सपना देखो साकार हुआ, 20 साल का अपना पंचायती राज हुआ।
कुछ सपने थे उन आँखों में, नए रंग उन सपनों में भर दिए हमने। ग्राम सभा को सशक्त कर आसमां छूना सिखाया है हमने। महिलाओं के स्वाभिमान को नई पहचान दी है हमने। 20 सालों में देश के हर गांव के कोने कोने तक पहुंच बनाई है हमने। सरकार की कई लाभकारी योजनाओं से जीवन में नई रोशनी भरी है हमने। पंचायत के माध्यम से पारदर्शिता और जवाबदेही सुनिश्चित की है हमने। आओ ग्राम सभा में अपनी भागीदारी को सुनिश्चित करें और पंचायती राज संस्थाओं को जवाबदेह और मजबूत बनाएं। 24 अप्रैल राष्ट्रीय पंचायती राज दिवस के उपलक्ष्य में केंद्रीय पंचायती राज मंत्रालय द्वारा जनहित में जारी।
4, 5, 6 पंजे
30।
दिमाग तो हवाई जहाज है तेरा।
नाना राकेट।
हाँ रॉकेट।
राकेट जी कहाँ? अम्मा खेत में आई है।
जा रख ले। मुन्नी बीमार जो होने वाली है।
बीमार?
खुले में शौच करेगी, उस पे मंडराएंगी मक्खियाँ, फिर वही मक्खियाँ तेरे बनाए खाने पर बैठ उसे दूषित करेंगी और मुन्नी को बीमार। घर में शौचालय बनवा और इस्तेमाल कर। जहाँ सोच वहाँ शौचालय।
लो आई तारा की मम्मी। सरपंच ने पूछा,
आज खाने में क्या बना? चावल, चना और हरी सब्जी। वहाँ है।
सरपंच ने दिया ध्यान, सरपंच ने दिया ध्यान, तो बने इतने पौष्टिक पकवान।
मम्मी, अम्मा, अम्मी, हमको कितना अच्छा खाना मिलता है ना?
बच्चों का अधिकार है शिक्षा और पौष्टिक आहार जो दे चुस्ती, खेल कूद और पढ़ाई के लिए। मिलकर करें इनका पढ़ना पक्का।
मिड डे मील योजना का लाभ देश के 11 करोड़ से भी अधिक बच्चे पाते हैं।
कच्चा था इसलिए टूट गया। कच्ची उम्र में बेटी की शादी करने पर यही परिणाम हो सकता है। जीवन को खुशियों से लबालब भरने के लिए बेटी की शादी 18 वर्ष और बेटे की 21 वर्ष के बाद ही करें।
अरे सुन तो।
मुझे क्या सुनाना चाहते हो? जो सुनाओ मेरी सौतन को।
किसको?
अरे वही तुम्हारा मोबाइल फोन जिससे सुबह शाम दिन रात चिढ़ाते थे और कहते थे किसान कॉल सेंटर से बातें हो रही हैं।
अच्छा ये बात है।
हाँ क्यों, क्या हुआ? अब बात नहीं होती क्या?
अब तो झट से बात हो जाती है।
ऐसा क्या?
हाँ अब तो ज्यादा लाइनें और खास तकनीक के कारण खेती के माहिरों से तुरंत बात हो जाती है। और अगर कभी लाइन व्यस्त हो तो अपनी समस्या फोन पर रिकॉर्ड करा दो, वहाँ से फोन आ जाता है और समस्या की हल का मैसेज भी आ जाता है। ये देखो आ गया।
अरे वाह, इसका मतलब इंतजार की घड़ी अब खत्म। हाँ तभी मैं सोचूं कि आजकल मुझ पर इतना प्यार क्यों आ रहा है।
कृषि संबंधी समस्याओं का अपनी भाषा में तुरंत हल पाने के लिए पूरे भारत में किसी भी फोन से हेल्पलाइन नंबर पर संपर्क करें। किसानों का दोस्त किसान कॉल सेंटर।
Welcome back to Public Forum. In Public Forum today we are talking about newborn deaths. Okay, let's start the discussion with you, Neeja ji. The greatest newborn mortality gap is also found among rich and the poor in the country, and that's where perhaps the problem one would believe starts. Poverty is one of the important factors. What would you like to say about that, and how do you think are the governments, the successive governments, have they been really sensitive towards this issue? Have they been able to address this issue to its core?
You know, I agree with Jay that while poverty is a major factor, why access to food and the right kind of food, the complementary food is not made available to the children when it should be, that is not the only reason. And I think there is a lack of awareness. I remember, for instance, talking to certain politicians once, you know, one from the Congress, one from the BJP, I won't take their names, and they had said that they were engaged politically, they didn't go back home for their grandchild to be given the first milk. So they were 6-8 hours had elapsed because of, and the grandfather is supposed to bless. One was a Muslim, one was a Hindu. This is a cultural practice. So the first hour of colostrum, which is supposed to be the first vaccine for the child, could not be given for these. So it is also a question of cultural practices, lack of right information, and I think those things have to be addressed majorly. But I would like to make, Shalini, 3 quick points. One is that unless the problem comes center stage, it is not peripheral, and this really has been peripheral problem. You know, the moment you talk about malnutrition, ICDS, which is the way to correct it, you just see the shoulders of politicians, bureaucrats, they will sort of go like this, you know, or it's the same old problem, what can we do with it? It may be the biggest social program in the world today, the ICDS, but it is not addressing the issue. So the issue has to come on the scanner again and again and frequently. Now, the National Family Health Survey, which is supposed to come out every 6 years, I think 6 years is too long a period. It should have come out in December of 2012. It is now getting into, you know, they're getting into action, so that means 3 years down the line. But the repeated suggestion has been at least every year at the district level, from the district level to the state level to the central level, this must remain on the radar. If it is on the radar, like they say, we are discussing it, there'll be some corrective action that will be taken. Number 2, I think it needs to be given higher priority. I want to here mention the case of Maharashtra, where a recent report indicated that in the last 6 years, chronic malnutrition came down 16%. Chronic, which is intergenerational, and that is because of certain interventions that were made and repeated monitoring. And the reason was the setting up of a nutrition mission 10 years ago under the Chief Minister, where they have an intersectoral approach to things and bring in all ministries. So it's not only WCD, it's agriculture, it's health, it's tribal affairs, and so on. And they act as a catalyst. And here, you know, I tried to study this a little bit. These positions, who heads the mission, who drives the process, these are not parking slots. They are headed by your best and the most credible bureaucrats who have a dedication to it, who drive the process. And I think time has probably come to look at the setting up of a nutrition mission under the Chief Minister of every state to give it the higher priority that it needs. Number 3, what Jay in the beginning mentioned, this really needs an approach cutting across parties, and the Citizens Alliance Against Malnutrition, which is led by MPs, younger MPs across parties in the last 5 years, and they have done, I think, very important. They played a role bringing it, you know, to the center of the public consciousness. Prime Minister says, you know, it's a national shame, malnutrition. The Planning Commission has now identified 200 worst districts where they're going to be zeroing in their efforts. I think somewhere the time has really come to say our children, we will put aside our narrow politic, we'll put aside our money making, let this be done in other areas, but not where our children are concerned and their lives and you know, living conditions are concerned.
Okay, Mr. Prabhakar again joins us on the phone line. Mr. Prabhakar, what would you like to say about improving the health infrastructure? We've been talking about the lack of efficient doctors and efficient nursing staff in the far-flung areas. We are at present, in fact, when we talk about rural population, we're not even including the urban poor in the count. But in fact, what would you like to say about improving the health infrastructure?
Yeah, and thanks for calling me back. Under NRHM, improving the health systems and their infrastructure has been top priority by the government. As Dr. Reddy mentioned, there are huge gaps in the number of doctors and staff, nurses and others in various public health facilities, especially as we go down the line in the periphery. But to address this, it is as Dr. Reddy said, it's not only the doctors, it is also the frontline health workers who are to be empowered or encouraged to take care of the health of the people at great extent, like especially like normal delivery can be done by auxiliary nurse midwives who are the ANMs. And under NRHM, second ANM has been provided in all the sub-centers and other places where deliveries are taking place. And we are strengthening various institutions which carry out delivery right from sub-center upwards, like PHC, CHC and district hospitals, by identifying centers as delivery points under the scheme, where we try to ensure that all aspects of reproductive, maternal and child health are covered, and all services related to this are given appropriate to the level of care. Like sub-centers, we are strengthening by giving the ANMs, trying to ensure that they are available round the clock to conduct deliveries, provide quarters there so that they stay there and conduct deliveries. They are available round the clock. Similarly, at PHC, we are increasing the number of staff nurses, like by say 2 to 3, so that they are available round the clock, do 8 hours duty, and provide 24/7 deliveries and other services. Similarly, CHCA, we are putting specialists. And another aspect is, as Dr. Reddy rightly said, there is a huge shortage of manpower. And to address this, what we are doing is multi-skilling the available staff. Like doctors, we have MBBS doctors, if specialists are not available, we are having special programs like trainings which empower them to conduct deliveries and to give anesthesia, so that they can take care of emergency obstetric care, and as well as the newborn babies who are born, they get special trainings are given to them so that they can take care, not wait for specialists where specialists are in short supply. So these are some of the things we are doing, not only infrastructure wise, but also the service delivery point of view by strengthening the existing.
That's right. But Mr. Prabhakar, we would also like to know about the initiatives that have been taken to fight malnutrition in the country. Since
Malnutrition is a very important because more than 1/3 of deaths of under 5 children can be attributed to underlying malnutrition. So we are seized of this matter, and tackling the severe acute malnutrition has been a priority area, and as many as 693 NRCs have been established across the country. But we also know that this alone cannot address, because malnutrition is a multi-sectoral issue to be tackled, and there is a high level of convergence with the ICDS schemes that we have been showing, that of the Ministry of Welfare, Women and Child Development, and we are working in close cooperation. And these children from NRC are referred to the from the Anganwadi center, and again they are followed up through the Anganwadi centers in a spirit of multi-sectoral cooperation. And we are also encouraging under NRHM various state governments which are doing the various nutrition missions, and we are supporting under NRHM various initiatives where in this many states like Karnataka, Gujarat, they are having nutrition mission, and which is being supported under NRHM.
Okay. Dr. Reddy, what would you like to say about these initiatives? Are these sufficient?
I think these are well meant, and I think they are making a difference. We should not grudge them their success. At the same time, we ought to ensure that there is a greater initiative taken to fill the gaps in the health workforce by training a large number of non-physician healthcare providers and letting them in the front line. We don't have to wait for specialists. As he has pointed out, both task shifting to lower levels of care and multi-skilling, that is task sharing, is going to be very important. These need to be supported extensively by efforts that are undertaken for influencing the social determinants, right from water and sanitation to nutrition, infrastructure like road transport. Like, for example, if a pregnant woman has a complicated delivery, can she reach a specialized point of care quickly? All of these are supportive services which are absolutely essential. So we cannot focus our attention only on compartmentalized schemes. They are important in terms of their verticality and accountability, but they need to be integrated very well into the health system and supported by multi-sectoral initiatives.
Okay, on that note, we'll take a very short break in Public Forum. Please stay tuned for more.
मानव शरीर के बीमारियों से बचाव के विभिन्न तरीके एवं आधुनिक चिकित्सा पद्धति व उसमें उपयोग किए जाने वाले उन्नत उपकरणों को समझिए लोकसभा टीवी से। प्रत्येक शनिवार प्रसारित होने वाले कार्यक्रम जीते रहो में
बापू का सपना देखो साकार हुआ, 20 साल का अपना पंचायती राज हुआ।
कुछ सपने थे उन आँखों में, नए रंग उन सपनों में भर दिए हमने। ग्राम सभा को सशक्त कर आसमां छूना सिखाया है हमने। महिलाओं के स्वाभिमान को नई पहचान दी है हमने। 20 सालों में देश के हर गांव के कोने कोने तक पहुंच बनाई है हमने। सरकार की कई लाभकारी योजनाओं से जीवन में नई रोशनी भरी है हमने। ई पंचायत के माध्यम से पारदर्शिता और जवाबदेही सुनिश्चित की है हमने। आओ ग्राम सभा में अपनी भागीदारी को सुनिश्चित करें। और पंचायती राज संस्थाओं को जवाबदेह और मजबूत बनाएं। 24 अप्रैल राष्ट्रीय पंचायती राज दिवस के उपलक्ष्य में केंद्रीय पंचायती राज मंत्रालय द्वारा जनहित में जारी।
बाय, ड्राइव सेफली।
आप एक कार क्यों नहीं ले लेते?
वो तो बस एक सपना है। वैसे भी मेरा स्कूटर है ना हमें घुमाने के लिए। शारदा, शारदा, ये गाड़ी किसकी है?
आपका सपना था ना।
ये
सपने अब सच होंगे।
आंध्रा बैंक।
Welcome back to Public Forum. In Public Forum today we are talking about tackling the issue of newborn deaths in the country. Right, so there are several schemes that have been initiated by the government to ensure that there is the institutional delivery takes place at a large scale, and also these health and nutrition services are available to adolescent girls. But when it comes to the ground level, Mr. Panda, I would like to know it from you. How do you look at these schemes? As I said in the beginning of the program, they appear so good on paper, but at the implementation level, perhaps we are not doing that well.
Look, it's very simple. We have no dearth of schemes. We have a wide range of schemes at central and state levels, and we are also committing significant amounts of funds to that. These are well intentioned, but the real problem is the delivery mechanism isn't delivering to a minimum level of standard that we expect, which is why the efforts of the Citizens Alliance Against Malnutrition, where MPs cutting across party lines and other people from civil society have been working, is we've been meeting the Prime Minister, the leaders of the opposition, chief ministers, other politicians across the spectrum to focus on one thing, that it must be implementation. You know, trying to focus on creating new schemes to address particular angles of the problem it's a case of diminishing returns. So what we have been doing, for instance, is, you know, the Prime Minister has a review meeting with chief ministers called the NDC, and there lots of other items get priority, whereas malnutrition never got any priority. We have been emphasizing in repeated meetings that it must figure in the agenda, and not just figure in the agenda, it must be among the top 3 items, so that at least every 6 months the Prime Minister and the chief ministers can review the situation of malnutrition across the country and in their individual states. Similarly, the nutrition missions in the states that we've been urging the chief ministers to set up is basically intended that this should remain top of mind for the chief executive of the state, the chief minister, the chief secretary. The top people must focus on malnutrition, just like the focus on law and order, or just like the focus on economic development, investment. This must be one of the top 3 items which they focus on, maybe on a weekly basis, but definitely on a monthly basis. So implementation is number 1. And the one other thing I'd like to say is, to keep the issue alive, we must get the media and other opinion makers to keep it alive, because we often keep thinking that we are now in the 21st century, India has grown so much, we've had so much economic growth, this problem is behind us. It isn't. As I have been emphasizing again and again, yes, India is growing, yes, many millions are today coming out of poverty and have aspirations, but yet we have got one foot stuck in the quicksand. We may have one foot on the treadmill going forward, but another foot is stuck in the quicksand. We need to get that out. And you know, we have other items that grab mind space. Cricket grabs mind space, Bollywood grabs mind space, politics, law and order, these grab mind space. But if we can keep malnutrition and the effect it has on our country's future on the minds of the media and opinion makers, then I think it will force us as a country that we need to focus on this issue. We can't just forget about it.
What would you like to say about the solutions that probably your report can also offer here to come out of this problem?
I'll come back to the first day deaths. The first day deaths happen basically due to 3 things, 80% of those deaths. One is preterm birth, the other is complications during birth, and the third is infections. And there are 4 products that we are recommending, and it costs actually about 350 rupees. So if one were to give antenatal steroids so that babies could, it would help babies breathe better, or including resuscitation devices and a simple thing like an antiseptic chlorohexidine for the cold care and injectable antibiotics. And this chlorohexidine and injectable antibiotics are things which the government of India so far has not agreed for the frontline health workers to administer. So it's not only important to have health workers in large numbers, as Dr. Reddy said, but also they have to be skilled. And along with the skills of giving the skill for them to administer these injections, but then the government also has to help to make sure that they can actually go ahead and do these things, because at this point of time it's not allowed. I'm told that the Ministry of Health is actually moving forward in in administering gentamicin injections and so on. This would actually save 1 million lives if these things come together with health workers, and if we are able to do all the other things that we were talking about in terms of the health system change, etc.
Yes.
We will be able to really save a lot more lives.
Okay, let us hear it from Mr. Prabhakar. Mr. Prabhakar, what would you like to say about the suggestions that were made by Mr. Chandy here?
Actually, we are in the active consideration of these suggestions, and injection gentamicin is in the active process of being given by the axillary nurse advice for cases of suspected sepsis. That recommendation is being given, and other recommendations are in active consideration and will be followed too.
Okay, Mr. Prabhakaran, thanks very much for talking to us. It was quite a pleasure having you here. Having a conversation with you on phone. Dr. Reddy, do you see this as the feasible solution, sir, that we can offer to the children in our country, or do you think that we have to, fight this situation at every level, as Mr. Panda has also said?
No, I think we must fight at every level. But then these are important suggestions where we can make an immediate difference. And enabling frontline care, particularly with antibiotics when required, and training them first to recognize infections and prevent sepsis or treat sepsis, all those are important. Even simple things like kangaroo care, where a mother is trained essentially to hold the baby close to the chest with a blanket, that itself warms up the newborn baby, and then apart from helping immunity with close contact, it also keeps the body temperature intact. So these are all important communication messages that we must send out to the people through effective health education as well. So this is a whole package of interventions. Each component of that package will have an impact, but taken together it will make a tremendous difference, and this problem can be handled and we can win over this challenge. But then it requires a societal effort.
Okay. Ma'am, what would you like to say about the role of the media here?
I think, for instance, violence against women, the recent gang rape cases have really brought out a response from the media which was unprecedented. Today, no case that they hear of does not get featured in a big way. It's headlines, it's not tucked into a corner of page 7, which used to be the case earlier. So somewhere, I think on this issue also, I think हमें गुस्सा नहीं आता है, हमें दुख नहीं लगता है. Somewhere we've got to get angry about these things. And I agree, because civil society.
We don't see malnourished people around us. Probably that's one of the things.
I don't know where we do see. For instance, urban slums, the problem is even more acute than in the rural areas today. So what is around us in Delhi, Bombay, Bangalore, Chennai, we're not looking at it right next door to us. I think somewhere, I don't know what the push is going to be, but and pilots are working beautifully. There are so many pilots across the country, but how to the scalability of it, so that actually the systems get delivered, and there is enough talent within the government system in the country today, dedicated people. There's no dearth of it, but I think maybe it needs a movement. Somewhere, I think, as I say, it's got to hit at our gut that this cannot go on any longer.
Okay, Mr. Panda, I would like you to also tell us as to how you think that the youth can be mobilized in this direction, and what role do you think that the NGOs can play here?
Well, I think this is the problem that requires involvement from everybody. As I have been saying, unless society itself is outraged about this, we are not going to get attention from politicians, we are not going to get attention from media, we are not going to get attention from anybody that counts. NGOs have been working towards this, but the solution does not lie only with government or only with NGOs. For example, you have examples of corporate social responsibility programs that have been helping. For example, in my district, because of the shortage of doctors, we have a 50% shortage of doctors because the supply demand situation is so unbalanced. They don't want to go and serve in rural areas. We need to create many more doctors. So in the meantime, if you can't have permanent availability of doctors, you can have mobile medical units which go and once a week touch a village. These are some of the efforts that are making a difference. Youth, of course, play a very important role, because in cases of other areas of outrage such as law and order and violence against women, which Neerja was just talking about, it is the youth outrage and the youth mobilization which has forced the government to put this agenda on a much higher platform. And half the country is youth today. If we can actually get youth to engage, if we can get young India to engage with this problem and see it as not someone else's problem but part of our problem, which we just can't forget about and can't leave it behind, I think it will compel the system to stop and make sure that attention is focused on the problem.
Okay, so on that note, we'll wind up this discussion. Thanks very much, Mr. Panda. Thank you very much, Dr. Reddy, ma'am, for joining us. And thanks very much, Mr. Chandy, for giving us a reason to discuss this issue. Thank you very much. So that's all we have for you in this edition of Public Forum. Thanks for watching. Goodbye.